Bonjour à toutes et à tous. Je vous propose de commencer.
Good afternoon. I'll start with a few words about the backdrop to show you where our research stands. Now, the first thing is that TB in children is often underdiagnosed. We know that about 60% of children with TB are not diagnosed, and that 96% of children who die with TB were not treated. So, in order to face this, the WHO has developed algorithms in order to provide more structured guidance for health workers and in order to improve TB diagnosis in children. As you can see here, on the left-hand side is algorithm A for entities with X-ray, and on the right is algorithm B for those who do not have access to X-ray. The algorithms are cards on which the health workers, doctors and nurses, on top of the diagnosis investigations, can tick the boxes of the symptoms that they have observed during the clinical examination, and in the end they get a score which will make it possible for them to decide about the prescription of anti-TB or any other type of treatment. MSF has developed a large project called TACTIC. As Kathy said, it means Test, Avoid and Cure TB in Children, and this aims at improving the diagnosis and the management of TB in children in several countries via support to field teams and advocacy for the implementation of algorithms, but also through the implementation of operational research. And that's the objective that the TB AlgoPed study tried to achieve. The TB AlgoPed study is made up of three parts. You have a prospective study that looks at an assessment of diagnostic performance. The second one is an analysis of routine program data, and there is a mixed method study in the middle that looks at the feasibility and acceptability of the algorithms. Today, we are going to focus only on this part here. In this feasibility and acceptability study, we have three main objectives. The first one is to identify these contextual and socio-cultural factors that could influence the algorithm adoption and the diagnostic process. The second one is to understand health workers, patients and caregivers' perspectives on the TB treatment decision algorithms, and to analyze the evolution of practices and potential changes led by the implementation. This feasibility and acceptability study will be carried out in 3 countries, Guinea, Niger and Uganda, which are currently implementing the algorithms. It's a combination of several data collection methods, interviews, focus groups, observations, which are done at 3 key moments of the implementation process. At the onset of implementation, after 6 months of implementation, and within 24 months of implementation. And this study targets a population made up of health workers, physicians, nurses, caregivers of children presenting with TB symptoms, and key informants. And today we are going to present the preliminary results of the thematic and critical discourse analysis. We carried out 45 interviews with health workers, doctors and nurses who attended the algorithm training. The interviews were carried out in Niger, Guinea and Uganda at the beginning of the implementation process. Now let's look at a few data about the context before implementation so that you understand the barriers to TB diagnosis. First of all, we asked health workers to describe the typical path of asymptomatic children and to explain what were the obstacles that they have identified. In a few words, the health workers consider that the main difficulty for them is to diagnose children which come to see them with a very deteriorated health status. And this is illustrated here. You have to read this from left to right. So, the health workers explain that some factors in the community, that's bottom left here, like the lack of resources, the lack of knowledge, the stigma, and the difficult access to health care will lead the families to first resort to self-medication or traditional medicine. Then, once they get to the healthcare center, that's the middle of the blue line here, there are other obstacles which make the diagnosis more difficult, such as the lack of knowledge of the staff, the fact that also sometimes you have to negotiate with the parents to be able to carry out the tests or investigations on their children. And also, some mention the fact that they have a shortage of test kits and or X-rays, or the X-ray machines are broken down, so they have to refer the kids and their families to another healthcare center, and this might actually lose them to follow up. So to summarize, there are a certain number of constraints in the community and in the families and in the healthcare centers. It's therefore a very difficult context in which the algorithms are currently being implemented. Let's now look at results about the health workers' attitudes. In general, in all three countries, we have seen very positive attitudes because the participants consider that the algorithms meet a real need which they have in their working context, and because they make it easier to make a decision. Therefore, healthcare workers feel that they are more empowered, more autonomous, because they don't need to rely so much on X-ray. And also, some healthcare workers also say that the algorithm enables them to save time during the consultations with patients. But then, for some agents, the algorithms being integrated into their daily work is a challenge because it's more work for them to perform on top of what they already have to do. And this illustrates the perceived efficiency of algorithms, which will now make it possible for them to better differentiate TB symptoms from other diseases and to therefore have a better rational diagnosis. And now let's look at the results coming from the interviews with nurses in Niger. We started the implementation a little bit sooner than in other countries, and so we had a little bit more perspective when we conducted the interviews. The nurses who use the algorithms claim that they are very useful because they make it easier to identify TB symptoms, and their use makes the clinical reasoning more legitimate, especially thanks to the scoring system, because actually they can objectivize their interpretations and their conclusions. However, also some say that the algorithms help them feel more empowered and more efficient in their work. However, some nurses who received the algorithm training but who were not involved in their use feel the feeling of exclusion and of negative attitudes, not towards the algorithms themselves, but towards the implementation process. And we can summarize this with those two quotations. The algorithm seems to have positive effects in terms of the status and role of nurses, which is illustrated by this verbatim where the nurse says, now with this algorithm we can actually screen the people, and we are proud of this. And for the nurses which were not included, you see that they would like to be included. As you see in this quotation, it says, now it's only the doctors who fill in the forms. If we were properly trained, we could fill in those forms. Doctors are not the only ones working here. We are always in contact with these children. It means that implementing the algorithms seems to be a good opportunity for nurses to improve their working practices and therefore to become more proactive in the diagnosis of asymptomatic children. conclusions. This analysis enabled us to identify different types of obstacles that give us information about the very difficult context in which we implement the algorithms. The discourse analysis shows, in general, a positive attitude to the implementation of algorithms because they consider them to be necessary to help them face the difficulties in their work environment. The implementation and use of algorithms empowers nurses, but these are only preliminary results, and they also illustrate that the expression of positive attitudes does not mean a change in work practices, because we have also identified challenges related to the excess of work or the feeling that they did not feel involved or that they lacked knowledge. So these results also illustrate the need to become more interested in the context of the health structures. For example, the definition of roles of agents and the distribution of work, in order to make sure that these innovative tools will be accepted and adopted. And the next phases of our study on the feasibility and acceptability will aim at exploring how the algorithms are perceived and adopted in the long run. Thank you for your attention.